A 64-year-old woman, wheelchair-bound for life, all because for 3 months, she ignored a mild backache each morning. Ever thought you just slept wrong? But after 60, back pain isn't merely sleeping wrong. It could be your spine's final warning. And sadly, many only realize when it's too late, when they can't stand straight, can't walk steadily, or are already bedridden. The American Geriatric Society says 42% over 65 face mobility issues from neglecting persistent back pain. Ever had a dull ache at night, legs go numb when sitting long, trouble bending, or notice your back starting to curve? Don't dismiss it. These small symptoms can mean something much bigger. In this video, I'll share 5 types of back pain older adults must not ignore, as they can be early signs of serious conditions. Timely intervention helps maintain mobility, independence, even lifespan. If you've ever ignored pain, hesitant to get checked, then today, please, just once, listen to your own body. And if this topic could help someone you care about, please share this video. A timely reminder can change a life down the road. Let's begin. Back pain seems normal, but if leg numbness accompanies it, numbness from hip to heel, it's more than just muscle fatigue. One leg suddenly goes numb with pins and needles, while your back aches relentlessly. You might be nearing permanent nerve damage and not even realize. Older adults often have back pain. Everyone knows this. But if that pain is accompanied by tingling, like ants crawling or pins and needles spreading to the buttocks, thighs, or calves, then it's no longer just ordinary muscle pain. It could be a sign a nerve in your spine is being compressed, and if not treated early, the consequences will be far more serious than you imagine. The spine houses the spinal cord and many important nerves. When a disc degenerates, slips out, or bone spurs from chronic inflammation grow, it can press these nerves, causing back pain, with sensation radiating down one leg, commonly called sciatica. Initially, it's just mild numbness, but if left untreated, it can lead to muscle weakness, difficulty walking, and even permanent loss of sensation. Some cases, left too long, may lose bladder sensation, requiring emergency surgery. According to the National Institute of Neurological Disorders and Stroke, nerve root compression is the most common cause of lower back pain with leg numbness in people over 65. And what's concerning is many just think, I probably slept wrong, or it's just old age, so they delay seeing a doctor. Thomas, 74, from Ohio, had a dull backache for many weeks. Initially, he ignored it, just using patches and rubbing oils. But then, his left leg started to go numb, his steps felt weak, and he lost balance. When examined, doctors found he had a herniated disc compressing his sciatic nerve. Fortunately, he got timely treatment with physical therapy and medication, avoiding surgery. If you have back pain and numbness in one leg, please don't just endure it. Not all pain is normal. Left too long, nerve damage can become permanent. And then, supplements or rest won't fully restore you. What you need to do isn't to worry, but to act immediately. Record your symptoms, where the pain radiates, at what times, if there's leg weakness, and take this when you see a doctor. An MRI or CT scan can clearly identify the cause, ensuring correct treatment so you don't have to endure more. Your back isn't just your body's pillar, it's the conduit for every step, every life sensation. Don't let a nerve be choked without rescue. Listen to your body. Sometimes a little tingling is its silent plea for help. There's pain that wakes you mid-sleep. Not intense, not sharp, just a dull ache like a whisper. Persistent back pain at night isn't a sign of old age. It might be your spine's final alarm bell. Before cancer has the last word. Older adults are often familiar with evening shakes, dull pain after a day's work or long sitting. But there's a very different back pain. Dull, deep in the bones, and notably worse at night, when resting, when all is quiet. If you experience this kind of pain and it lasts for weeks, please don't assume it's just old age pain. This could be an early sign of a more serious illness, bone metastasis. In people over 70, back pain at night, not easing with rest, and often centered in the spine, is a key warning symptom in diagnosing primary bone cancer or metastasis from other areas like the lungs, prostate, or breast. More frighteningly, this pain typically doesn't respond to common painkillers and becomes more distinct when the body is tired. An American Cancer Society study indicates in older adults, 60% of bone metastasis cases initially present through persistent back pain, especially at night. In many cases, reach the hospital when it's already too late, just because they thought this pain must be due to age. Margaret, 78, from Illinois. She had back pain nightly, struggled to lie flat, often waking midnight from sharp pain. She thought it was just arthritis and endured. At the hospital after 2 months, doctors found a small tumor metastasized from her lungs to her spine. Fortunately, the tumor was early stage and treated promptly. If you or a loved one are experiencing such dull aches, especially at night, then please don't delay. You don't need to panic, but you absolutely shouldn't stay silent. Night pain is abnormal pain, and your body is sounding an alarm. See a doctor if pain persists beyond 2 weeks, showing no improvement with rest and common painkillers. Your doctor might order an MRI, X-ray, or blood test to exclude serious underlying causes. Your body doesn't lie. When it aches dully, especially at night, that's not just fatigue, but a quiet call reminding you, listen to me before it's too late. Dull night pain can be a late warning, but another type, sudden, sharp pain after a seemingly minor fall, is an urgent sign many casually overlook. A slip on a stair, an awkward sit-down, and you might lose your ability to stand independently for the rest of your life. The older you get, the more brittle your bones become. Every fall, a slight trip in the bathroom, a slip in the yard, or missing a stair can have serious consequences. But the sad truth is, many older adults after falling feel just a dull ache and try to tough it out, not getting checked, only to later discover a bone had been cracked or broken for some time. Fractures in older adults, especially in the pelvis, spine, or hip, don't always show clear signs like swelling or deformity. Many cases only involve pain when turning, standing, or changing lying positions. And the scariest part, the pain doesn't always scream. It just simmers, enough for you to be complacent until you can no longer walk. But if a fracture goes untreated, the risk of paralysis, infection, pneumonia from prolonged bed rest, and even death within months is very high. According to the Centers for Disease Control and Prevention, or CDC, up to 95% of hip fractures in older adults result from falls. And of those, almost half aren't detected promptly due to complacency. Statistics also show seniors with hip fractures have a 20 to 30% mortality rate within 12 months. Raymond, 81, from Florida, once slipped in the bathroom. He felt only mild back pain, thinking probably a pulled muscle. He kept walking, just using pain patches. 2 weeks later, sharp pain and leg weakness prevented him from standing up. An X-ray then revealed a spinal compression fracture, and treatment became more challenging because it was delayed. If you've just fallen, even if you feel you can still walk, get an X-ray to be sure. Fractures in older adults don't always scream like we think, but silently erode stability daily. And sometimes just a few days delay lets recovery slip from your grasp. After any fall, visit a medical facility for an X-ray or CT if there is any unusual pain, whether it's mild, vague, or just a strange feeling in your back, hip, or leg. Don't just take painkillers or try to tough it out, because enduring only makes bones weaker. Your body has stood strong for many decades. Now it needs your protection more than ever. One timely checkup could save you from an entire year bedridden. If you're still watching and finding this helpful, drop a 4 in the comments to let me know. And if you haven't subscribed, I'd love it if you hit subscribe and the bell so you don't miss new videos. Your support helps us create more useful, inspiring content. A fall can break bones, but sometimes you haven't even fallen. Yet your back still aches, curving down a little more each month. If clothes suddenly seem longer, your back stoops a little more. Don't just chalk it up to old age. That could be your spine's final warning before a minor fall turns into a disaster. Ever look at old photos, then silently realize, I stood so straight then. Why is my back curved? Why am I shorter now? Many seniors assume it's natural, that stooping is just part of aging. But in reality, a back curving over the years isn't just a sign of age. It can also be a silent warning from your skeleton. Serious osteoporosis is underway. Osteoporosis reduces bone density, making bones brittle, weak, and prone to collapse, especially thoracic and lumbar vertebrae. When multiple vertebrae slightly collapse repeatedly, the spine can no longer maintain its straight axis, leading to the stooped back often seen in older adults. This curvature not only makes you lose height, but also impacts breathing, digestion, and even your ability to keep balance when walking. The National Osteoporosis Foundation states 1 in 2 U.S. women over 60 has osteoporosis, and many don't even realize they have it until their back is stooped, or worse, they break a bone from a minor fall. Joan, 76, from California, was once very agile, stood straight, and often walked in the park each morning. One day her old jacket seemed longer, but really she had gotten shorter. At a routine checkup, her doctor found she'd lost over 3 centimeters in height from spinal collapse due to osteoporosis. She then began calcium, vitamin D, and daily light exercises to protect her remaining bone structure. If you notice your posture changing, back stooping, clothes fitting longer, don't ignore it. Osteoporosis often doesn't cause obvious pain until too late, but a curving back is a valuable signal you must listen to. Get your bone density measured. It's a simple, painless test that can show your current bone health. Additionally, supplementing with enough calcium, vitamin D, eating sufficient protein, and keeping up gentle exercises like walking, yoga, or resistance band training are effective and safe ways to protect your bones. Your bones are the sturdy frame that supported your life for 70, 80 years. Don't let that house tilt because you forgot to care for it. Simply observing yourself in the mirror each morning, you'll know when it's time to act. Back pain is already a sign to heed, but if you also suddenly struggle with bladder control, rushing, leaking, or incomplete emptying, please don't delay another day. Are you finding it hard to urinate or suddenly leaking urine uncontrollably after several days of back pain? Your body might be entering an emergency. Permanent paralysis could be mere hours away. Back pain in older adults is common, but if it's accompanied by symptoms like difficulty urinating, retention, or even loss of bladder control, you absolutely must not ignore this. It could signal a dangerous condition needing immediate emergency care. Cauda equina syndrome. This is a rare but extremely serious condition, occurring when nerves at the spinal cord's end, controlling the bladder, bowel, and legs, are suddenly severely compressed. Without emergency decompression surgery within 24-48 hours, the patient can face permanent paralysis, loss of bladder and bowel control, and lifelong dependence. According to Cleveland Clinic, Cauda equina syndrome often begins with severe back pain, radiating down one or both legs, accompanied by numbness in the saddle area between the legs and sudden changes in urination such as dribbling, retention, or leaking. Though it's not common, older adults with herniated discs, spinal injuries, or spinal stenosis are at increased risk of experiencing it. Daniel, 79, from Oregon, had a dull backache for several weeks. One morning, his legs felt extremely weak, he lost bladder control, and the area between his thighs went numb. Luckily, his son immediately called emergency services. He underwent emergency surgery that night and kept his mobility after a lengthy recovery. Doctors said just a few hours' delay would have changed the outcome drastically. If you or a loved one experience a similar situation, back pain with difficult or uncontrolled urination, please don't hesitate. Don't use painkillers. Don't wait to go tomorrow. This is when you must get to an emergency room immediately to protect vital bodily functions. The only thing to do in this situation is to act fast. Remember these red flag signs: severe back pain with leg weakness, numbness in the lower body, urinary dysfunction. These are not everyday symptoms, but an urgent warning bell from your body. You've cared for your body your whole life. Now is the time to recognize when it needs your help most. One timely decision: can preserve your entire independent life ahead. Your spine helps you stand firm, but it's also the first to warn, I'm tired. And if we just think that's normal, just endure, just live with it, then eventually, the body won't be able to take it anymore. After 70, bone and joint health can't be ignored. A slip due to pain, an inability to rise from a chair, can mark the start of dependent days. But the good news is you still have time. Time to recognize, to check, and to change. Just listen to your body a bit sooner. Give it that doctor's appointment, a gentle exercise routine, timely attention, and sometimes that very small thing can save you from losses you can't get back. If today you realize that, then please let a checkup, some light exercise, be your way of telling your body, I still want to go much further. And if this video makes you think of someone, an old friend, a relative, or a neighbor who often mentions morning back pain, please share this video with them. A simple share could be the gentle push they need to act promptly. Thanks for sticking with me. I hope you keep your back straight, not just to walk steadily, but to hug grandkids, stroll around town, and sit at the table and go and needing no one's help.